Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
I think we're in this really unusual time. You know, we can all say it's the pandemic or it's this or that, but really time is moving forward and we keep looking to our own experiences to frame our kids' experiences, and we can't do that anymore.
So how can parents better understand their kids, even if they can't necessarily relate? In today's Healthier Together, we're hearing from a local school counselor who says as we strip away the stigma of mental health, it opens up room for better understanding and better overall health. And when it comes to kids and teens who are part of our LGBTQ+ community, support from family and friends is a crucial part of mental health. According to the 2022 National Survey on LGBTQ youth mental health, 45% of LGBTQ youth seriously considered attempting suicide in the past year. But it also found LGBTQ youth who felt high social support from their family reported attempting suicide at less than half the rate of those who felt low or moderate social support. Beth Russell is a student support and wellness counselor who works with middle schoolers.
I think a lot of our kids who are part of the LGBTQ+ population are trying to find themselves in a unique way. There's a lot of fear of rejection. Sometimes it's unfounded. Sometimes it's incredibly legitimate. They don't know how their friends are going to react. They don't know how their parents are going to react.
Russell says kids are constantly internalizing the world around them, seeing how people interact in public, what they hear on TV or online, and in turn, LGBTQ+ youth are assessing their own safety based on that.
Right? We're seeing laws changed, we're seeing fights, we're seeing protests, we're seeing unsafe situations. And every day is an assessment of what is going to be safe for me today. And sometimes it's emotional safety and sometimes it's physical safety.
So what can we do to address those concerns and help our kids struggling with mental health?
I think a lot of our students are super aware of their mental health and their needs. And when they try to advocate for themselves, adults say, well, I wasn't like that when I was young, or you can't possibly know how you feel. You couldn't possibly know your gender identity. You couldn't possibly know if you have anxiety. You can't possibly know if you're depressed. And a lot of that is written off. And while that's meant to be like well-meaning from parents, I think it ends up alienating.
Russell says the first step to help your kids, listen and validate.
I think just trusting kids and saying, okay, you tell me you feel a lot of anxiety or really stressed out about this. Can you tell me more about that? What are some things that you've tried that have made you feel better? Is there anything I can do to support you in that? Rather than immediately trying to fix it, letting the kids give us the answers. A lot of times they don't need us to fix the problem. They need us to hear them and trust them to help guide their solution.
And then ask, what do you think we should do?
You want to protect them. And we can't always protect them, but we can love. We can love each other, we can love our kids, we can trust our kids. And the more we are there to support our kids, the more they will be there to talk to us when they are struggling.
There are so many resources for both you and your kids, from national online resources to grassroots programs in your community. And if you or someone you know is in crisis, there's always help available. The number on your screen is the Suicide Prevention Lifeline, 1-800-273-8255. Counselors are there to talk 24/7, and you can connect with local services. We're going to bring you a Healthier Together segment every week here on KGW. Next Tuesday, we'll focus on seniors in our LGBTQ+ community, their unique challenges when it comes to mental health and resources.